Well, actually, we don't know yet what causes prostate cancer, but we know there are some predisposed factors that could cause prostate cancer. We know that men over 50 have more prostate cancer. We know that people who smoke cigarettes have more prostate cancer. We know that people who have more animal fats in their diet seem to have prostate cancer more than anybody. And we also know that race is also important. We know that the African American have more prostate cancer than the African that live in Africa. We know that the Japanese that live in the States have more prostate cancer than the Japanese that live in Japan. And we know that Japanese have more prostate cancer than Thai. So it's also both races and diets and other factors that could cause prostate cancer. The prevalence is increased when you get older. We don't know yet, but we know that if you are old enough, eventually you would have prostate cancer. We have studies that the pathologists removed the prostate from people who are older than 80s, and they found that if you are over 80s, 80% you have prostate cancer in your prostate. The PSA is stand for prostatic specific antigen. Is the enzyme in the prostate cells. It's a natural enzyme, and everybody have it. But once you have prostate cancer, these prostate cancers destroy the normal structures of the prostate. So this enzyme leaks into the bloodstream, and we could test that measuring the PSA in the bloodstream to tell if you have prostate cancer or not. The PSA is not a perfect test. There are many other things that could increase the PSA. It could increase because you have an infections, you're unable to pass water, you have some instrumentation, some surgery in the prostate, then that all will increase the PSA. And there are also some patients that have elevated PSA without any known cause. So it's not a perfect test, but at least we have something to screen for prostate cancer. The prostate cancer treatment is very different in early stage and late stage. If you have an early prostate cancer, you also have to look at the Gleason score. You need to know if this prostate cancer is an aggressive one or non-aggressive one. The prostate cancer is very common, but if you have a non-aggressive one, you may not need any treatment. There are a range of treatment from doing nothing to have a surgery. So if it's a non-aggressive prostate cancer, then you should not have a very aggressive treatment. In the same time, if you have an aggressive prostate cancer, then you need an aggressive treatment like surgery, radiation. In a late stage prostate cancer, that means you have a prostate cancer that spread to the lymph node or other organs in your body. That means we cannot cure it. But we still have a medication that could prolong the patient's life and suppress the cancer, control it. And in some good cases, we could control it for over 10 years. And these medications are the medications that would suppress the male sex hormone production. And it could last for many years. In the patient who have early stage prostate cancer, and we know that it's a low-grade cancer, it's non-aggressive cancer, and the amount of cancer is not much. Especially in a young patient, we may choose to do active surveillance, which actually doesn't mean we do nothing. We would need to follow the patient with the PSA, we need to do ultrasound, we may have to repeat the biopsy to see if the cancer has progressed or it has turned into an active, aggressive cancer. And once we know that the cancer has progressed or it's turned out to be more aggressive, then that's the time that we need to do the treatment. The problem is it's fairly difficult for the patients to have cancer and we tell them to do nothing. So we found that around 30% of the patients will stop the active surveillance after 3 to 6 months. High frequency ultrasound wave treatment is a new treatment. It's like you use an ultrasound wave, which is about 10,000 times stronger than the ultrasound. This ultrasound wave will heat up the prostate cancer cells and destroy it. We normally use this kind of treatment as an optional treatment for the patient who have low or intermediate grade cancer. This is where the HIFU come in, because when you do have non-aggressive or low aggressive prostate cancer, you tell the patient to do nothing and just keep an eye on it. Some of the patient will refuse to do so. So this is where these treatments come in, because this will only destroy the prostate cancer cells and destroy the surrounding prostate cells. We have less side effect, and the treatment is not aggressive. So what we do is we introduce the ultrasound probe into your rectum, and then we use the computerized scan to identify where is your prostate, where is the cancer, and then we use the computer to control the robot's arm that will move the ultrasound probe and slowly destroy these cancer and prostate cells bit by bit. For the surgery and radiations, the treatment is more aggressive. So you have a slightly better result, but with this result, you have to sacrifice something. And most of the common side effects are incontinence, erectile dysfunctions, and bladder inflammation. The HIFU have less of this, because when we do the treatment, we use the ultrasound to monitor the treatment, and we do it slowly, little by little, and we're using the robotic arm to control the ultrasound wave. So this way we would be able to try to avoid the nerve that control your erections, try to avoid the sphincters that control your continence, avoid the bladder, and avoid other structures close by. And we monitoring it on a real time, so we will always see where we are treating the patient. There are a few lifestyle changes that you could do to reduce prostate cancer and also to detect it early. First thing, if you smoke, you should stop smoking, because it's not good for your prostate. It's also not good for other organs as well. You have more lung cancer, you have bladder cancer, kidney cancer, so it's important that you stop smoking. Reduce the animal fat in your diet. We have studies that study the Japanese that moved from Japan to Hawaii, and we found that the first generation Japanese that moved to Hawaii have slightly more prostate cancer than Japanese that live in Japan. And the second generation Japanese in Hawaii have higher risk of prostate cancer. The reason is the diet, because the first generation Japanese who moved to Hawaii, they still eat the same diet that they have in Japan. The second generations, they become westernized, so they eat more of the animal fat, they eat more Western food, so they have more and more prostate cancer. So if you could reduce all these animal fat in your diet, then the risk should be less. Another thing that you could do, this is just a theory. We found that if you have enough vitamin E, it might reduce the risk of prostate cancer. And the best way to get vitamin E is to have a contact with sunlight. So you could go around in the morning, have a contact with sunlight for half an hour every day. That would increase the vitamin D in your body and reduce the prostate cancer. We used to follow the United States recommendations. We used to do the PSA after 50 in every person, but now it's changed. The US FDA have changed their recommendations. They have said that you should not screen PSA in a normal population. You only screen PSA in people who have risk. For Thailand, we don't have that recommendation yet. So we are in the middle. If you have high risk for prostate cancer, we definitely will screen you. If you don't have any risk, then we recommend that you should have a test at some point in your life, but you may not have to do it every year. There is interesting studies showing that if you are, let's say, 45 to 50 and your PSA less than 1, then the chance that you have prostate cancer in the lifetime is very small. So we are now thinking about doing screening, let's say when you're 50, and if it's less than 1, then you may do it every 2-3 years. But if you have high risk, you have some other risk, you have family members who have prostate cancer, then you probably have to do it every year. Well, prostate cancer is most common cancer, but it's more than half of it is a non-aggressive cancer. So you don't need an aggressive treatment to all these prostate cancer. You may do a screening, you find prostate cancer, and if you find it, then you have to think about it. You may not need aggressive cancer in every patient. You need to stratify the risk. You need how aggressive the cancer is, and then you choose the treatment that fit for the patient. You don't go surgery every patient.